Hello viewers and welcome back to my channel. Today I'm excited to discuss a groundbreaking development in the treatment of tuberculosis in children and adolescents aged 10 years and below. In Kenya, a new innovative treatment guide has been introduced to address a non-severe tuberculosis in this vulnerable population. This new approach involves a shorter 4-month treatment regimen known as 2-RXZD and then another 2 months of 2-RH. That means 2 months of rifampicin, isoniazid, pyrazinamide, and ethambutol. And then another 2 months of rifampicin and isoniazid, which has actually shown promising results in effectively combating the disease. The aim of this presentation is to provide you with a comprehensive understanding of this newly adopted treatment guide and highlight its potential benefits for the young patients. Guys, the introduction of this shorter treatment regimen marks a significant step forward in the fight against tuberculosis in children and adolescents. By reducing the duration of treatment from the previously recommended 6 months period to 4 months of treatment, this innovative approach offers numerous advantages. Not only does it lessen the burden of young patients and their families, but it also increases treatment adherence, increases the risk of developing drug resistance. Guys, the effectiveness of the 2-RHZE and then another 2 months of RH regimen has been extensively studied and proven. Research studies have shown that it is just as effective in curing tuberculosis in children and adolescents as the traditional 6-month treatment regimen. Additionally, this shorter regimen duration has not been associated with any increased risk of relapse or adverse effects. Furthermore, the widespread implementation of this new regimen guide is crucial in the ensuring that all young patients receive the best care possible. By raising awareness about this innovative approach, we can bring about positive changes in the healthcare system, ensuring that all children and adolescents with tuberculosis have access to timely, effective treatment. Yes, guys. The introduction of the 4-month treatment regimen for tuberculosis in children and adolescents is a significant breakthrough. Its potential benefits include increased treatment adherence, decreased risk of drug resistance, and improved overall outcomes. I can say it cannot be overstated. By spreading awareness and advocating for the widespread adoption of this new treatment guide, we can make a real difference in the lives of young patients affected by tuberculosis. Guys, I look forward for your feedback and support after the end of our discussion. Guys, there are a few things that I need us to note. We have to know that not all children under 1 year old will require the 6-month regimen. Please note that not every child will be eligible for the new regimen criteria of 4 months. Eligibility will be determined based on the following factors. 1. Age. 2. Type of TB. 3. Immune status. 4. Bacteriological status. And then lastly, treatment regimen. I want us to look at the age criteria. Children who are 1 year old or older, up to 10 years old, and have non-severe tuberculosis will be eligible for a 4-month regimen. Infants under 12 months old and children above 10 years old, that is 11 to less than 15 years, with severe TB will qualify for a 6-month regimen. Yeah, the severity of the TB will determine. Let's look at the criteria of TB type. There is non-severe pulmonary TB and then there is severe pulmonary TB. In the non-severe pulmonary TB, children in this category should be stable enough to be managed as outpatients at the time of diagnosis. They should not exhibit any danger at all. This category includes children with TB, cervical, lymph node enlargement. Guys, let's now look at severe pulmonary tuberculosis. This involves all hospitalized patients at the time of diagnosis. And then also children who are severely ill at diagnosis with any danger sign, such as difficulty in breathing with associated central cyanosis, grunting, oxygen saturation below 90%, increased rate of respiration, and then 2 to 12 months pulse rate over 50 per minute, and then 1 to 5 years pulse over 40 per minute, 6 to 10 years pulse over 30 per minute. Children who are unable to drink or breastfeed, have a weak or absent pulse, are in a coma, are experiencing convulsions, confusion, are unresponsive to pain, or any completely unresponsive. All children with extrapulmonary TB, excluding those with TB of the cervical lymph nodes. These are considered severe tuberculosis. Guys, hope we are still together and keep listening and remember to ask questions. Guys, in regards to individuals' immune status, individuals who have a negative HIV status, non-severe acute malnutrition, and no other immunosuppressive conditions are classified as non-severe. As a result, they are eligible to receive a 4-month regimen. On the other hand, individuals who are HIV positive, suffer from severe malnutrition, or have immunosuppressive conditions are classified as severe cases of tuberculosis. Consequently, their treatment will extend for a duration of 6 months. Now, considering the bacteriological status of the individual, those who are clinically diagnosed with a negative bacteriological status are classified as having non-severe tuberculosis. Consequently, they qualify for a 4-month regimen consisting of 2 months of rifampicin, isoniazid, pyrazinamide, and ethambutol, and an additional 2 months of rifampicin and isoniazid. Conversely, individuals who have confirmed positive bacteriological results are deemed to have severe tuberculosis. Thus, their treatment will span over a period of 6 months, involving 2 months of rifampicin, isoniazid, pyrazinamide, and ethambutol, followed by 4 months of rifampicin and isoniazid. It is important to understand and address these classification criteria in order to ensure appropriate treatment for patients. By identifying the severity of the condition and considering the immune and bacteriological status of the individual, healthcare professionals can determine the most suitable treatment regimen for the patient's specific case. Otherwise, guys, thank you so much for listening. And thank you for subscribing to the channel. Don't forget to ask questions in the comment section so that we can put it into discussion. Thank you, guys.